The Prime Minister visiting three crucial facilities in three different cities, which are the nerve center of India's plan for self-sufficiency for a COVID-19 vaccine. So in this three-city tour, the Prime Minister has already visited the Zydus biotech park in Ahmedabad this morning, the Zydus Kerala facility. He's expected to visit BharatBioTech in Hyderabad at around 1:30 this afternoon, and the Serum Institute of India in Pune later in the day at 4:30 p.m. Dr. Hemant Thacker joining us for more on this. Dr. Hemant Thacker, very good morning. Give us a sense of how much time it will actually take and what, in your view, will be the final picture. Are we looking at a scenario, say, in the middle of 2021, where there is more than one vaccine? In fact, there's quite a choice for patients to look at which one suits them better, which is more available, considering that there's so many competing right now to make it to the finishing line?
So, madam, we are looking at the finishing line. And when you run a race, you don't look right or left. You look at the tape which you have to breast. Whether the vaccine comes in March, in April, in May is not my concern. My concern is what Modi's concern is. Prime Minister Modi has put his foot correctly where he has gone to inspect each of the facilities. It reminds me of my school days when we had an inter-school competition and the chancellor of the university went to the three top schools that were going to compete. So if the chancellor has the heart, the faith, the trust, and the entire country's benefit at heart, he goes to visit these places. And I'm sure the country will pick the right vaccine, the safe vaccine, the one which is properly transmissible, which produces results. I'm not here to say when it's going to happen or which company is going to win. I only want India to win like Prime Minister Modi. So I think we should hold our breath and we should really take this as an acclaim that the number one person of the country has gone at the ground level to meet the scientists, to see. Because he is not concerned about economy. He is not concerned about transport and tax. He is concerned about health and vaccines. So for me, this is a shot in the arm for the medical healthcare facilities. And we will wait. I think the vaccine results will unfold. In the next 6 weeks to 12 weeks, we will know who is getting where. And India will choose the best vaccine for its citizens. This is my take.
Dr. Hemant, where do you see the challenges coming forth? Now, of course, the scientists at all of these facilities are working on developing the vaccines and they will take their own stated procedure. The companies will share their results and then the authorities in each government will verify these, hopefully. But do you think that the real challenge up ahead will be in the distribution system? How are you going to get these vaccines across to a larger number of people, especially since these are all two-dose vaccines?
So actually, I am happy that we are going with Indian vaccines because the Pfizer vaccine and the Moderna vaccines are new technique, which is the mRNA, which is not yet tried and tested, which is new. Now, our vaccines, which is the attenuated virus, are the ones which I would like to go with. Now, your question of how will it be transported? If you see in the last 1 week, the health ministry and the officers are already looking at transport and storage facilities. So they are thinking 2 steps ahead of production. If we get an Indian vaccine of good accuracy with 2 doses, I'm quite sure, at least because now India is well connected through train, through road, and we have gotten over all the rainy season. So we should not have much of a problem. I'm not an expert on demographics to say how it is going to be passed on. But if we can have internet facilities for remotest of villages, storage facilities and ability to give our nurses, our healthcare workers are all very good. I would take that step by step. First, choose the vaccine and start pointing out where are the places they would store it. By which time everybody is forgetting that the virus is going on in the community and we are acquiring herd immunity. So the virus is dropping in its virulence. We are preparing for the vaccine. Everything is going simultaneously. My message is don't forget your mask at home, your sanitizer and distancing. You've foregone Diwali, please forego Christmas and New Year and 2021 will usher in a better year. That's my message.
That's the important one, really. Thank you, Dr. Hemant Thacker, for speaking with us this morning. So the vaccines are being prepared. The Prime Minister is visiting these 3 facilities today. One assumes for a status check on what is happening, even as India now faces the challenge of distribution. I think never before in human history would an attempt have been made to vaccinate such a large proportion of the adult population almost at the same time.